I would like to invite Mr. Jon Levingston, Executive Director, Crossroads Economic Partnership. Stage is yours, sir. Thank you.
Good afternoon. To the esteemed Mr. J.A. Chowdhury, to his team of extraordinary executives of the International Startup Foundation who created and sponsored this festival, I thank you for inviting me to share my journey in working to create a more sustainable and accessible ecosystem of healthcare for my area of the United States. In the state of Mississippi, known as the Delta region, the poorest rural region of the poorest state in the United States. Now, when I told some of my colleagues back home in the U.S. that I was going to India to discuss with so many brilliant young entrepreneurs and investors in India about what we in the Mississippi Delta are doing to address health inequities, lack of access to adequate health care, and the issues of financial sustainability for healthcare facilities in our region, they asked me, why India? Why this group? Why now? Well, I think the answer to those questions may be informed by two thoughts. First, the community I come from shares many things in common with certain rural areas of India. We have a very high poverty rate. Transportation for many families is difficult, and a lack of access to adequate health care, coupled with unhealthy lifestyles, has created a population base in which many people suffer chronic illnesses and infectious diseases. These facts, underscored by historical events, promoted generational cycles of poverty that contribute to poor education outcomes, a higher crime rate in our communities, and presents workforce challenges that make recruiting industry to our area a challenge. And yet, families in rural India and our families in the rural United States have a fundamental and heartfelt desire in common. They each hold the common hope for a better future for their children and grandchildren. And second, during recent decades, we in the U.S., if we are paying attention at all, have witnessed a resurgence in South Asia, most especially in India, in the fields of technology, in the development of new pharmaceuticals, in space exploration, in the defense sector, counterterrorism, the cyberspace, in Make India, as discussed by Prime Minister Modi, and in the general economic growth and development. India is the country that more and more countries are turning to for leadership and partnership. In a recent International Monetary Fund public financial blog, the author notes, and I quote, "India's most recent decade of economic growth from 2014 to 2024 has been characterized and driven by structural reforms, innovation, and prudent fiscal management. And in the area of geopolitics, India has become an indispensable ally. India is addressing, under the most severe restraints, many of the challenges faced by rural U.S. regions with an entrepreneurial zeal and a resourcefulness that has compelled many of us in the U.S. to pay attention to what is going on here so that we may learn and grow from your experience." Let me give you an example of what I'm talking about. When I learned in mid-2022 that our regional hospital was in danger of closing, and I and my agency were assigned the task of keeping it open, I traveled to Bangalore to implore Girish Krishnamurthy, the CEO of Tata Medical and Diagnostics, to share with me the program of health care they developed for the rural regions of the state of Karnataka. I did this because I was aware of the innovative, pragmatic nature of their program and wanted to see it in action firsthand. And I was not disappointed. I took great inspiration from their practical approach to successfully reaching an undereducated population living in poverty, teaching them how to access the new healthcare facilities that were recently built, and assisting patients through tech solutions to monitor health outcomes throughout the state's population. And when I returned to the United States following my 2022 visit, I discovered that the group leasing and managing our hospital was losing money at an increasingly rapid rate and intended to close the hospital within 60 days, much sooner than we had expected. If shuttered, the nearest trauma center would be almost 2 hours away by ambulance. More significantly, we would have no labor and delivery services in the northwest sector of our state, and that would have imperiled the lives of thousands of mothers and infants. But beyond labor and delivery, what would the broader impact be if this healthcare facility closed? Well, the answer lies in understanding the conditions of our region, the Mississippi Delta. And that region is a 19-county area in the northwest part of our state. It is an alluvial floodplain and contains among the richest soil in the world. Its economy has traditionally been agriculturally based, although recent efforts have been successful in developing a nascent industrial base. But nonetheless, and for historical reasons, the region has the highest poverty rate in our state and among the highest per capita in the United States. One consequence of this high degree of poverty is demonstrably poor health among many of its citizens. According to the U.S. Center for Disease Control, among Americans 35 years and older, Mississippians have the highest mortality from heart disease in our nation. Further, African Americans, who make up a disproportionate share of the Delta population, are twice as likely to have a stroke as whites, and the relative risk of dying from that stroke is even higher. According to the Mississippi State Department of Health, the population of our region, the Delta region, has among the nation's highest per capita rates of cancer, diabetes, and other chronic diseases. The publication U.S. News and World reports that Mississippi has the highest rate of sexually transmitted diseases in the United States, and the Delta region leading the state. And these numbers are rising. As reported in the September 13th edition of the online state newspaper, Mississippi Today, and I quote, "In the 6 years ending in 2021, Mississippi saw a 900% increase in babies born with syphilis passed to them during pregnancy." Finally, and perhaps most tragically, according to the U.S. Centers for Disease Control and Prevention, Mississippi has the highest infant mortality and maternal mortality in the U.S. Additionally, as reported in the same edition of Mississippi Today, black babies are more than twice as likely to die before their first birthday compared to white babies. This is the world, and these are the circumstances in which we live and for which we are charged with addressing. As we have told our political leadership, our job is not just keeping open a hospital, although that is part of it, but it is also about finding a way to successfully address the humanitarian crisis our people face. Therefore, closing our hospital would increase and accelerate an already alarming trend, which is that of perpetuating health and wealth inequities, ensuring a grim future for generations to come. So one might rightly ask, how do we propose to address these appalling and tragic circumstances? Following a prolonged negotiated buyout of the lease from our former lessee of our hospital, our team took over operation and management on May the 1st, 2023. we discovered the once thriving hospital had been taken apart, department by department. We were left without a CEO, without a CFO, an HR director, an IT director, no accounting team, no head of plant operations. In short, we became the managers of a hospital bereft of the capacity to survive on its own. One consequence of the slow dismantling of services in the name of cost-saving measures was the inability to service the number of patients we once had. We learned that, not surprisingly, as services and personnel had been diminished in recent years by the previous management group, the number of babies delivered in our facility steadily dropped, leaving many underage pregnant girls without care. In the 16 months since we began operation, we put together a leadership team of community leaders, elected officials, a seasoned cadre of lawyers and consultants who specialize in rural health care. We hired new executive leadership, new department heads, realigned up the salaries of existing employees, found efficiencies of economies, and developed a plan for our future. We have increased our daily census to almost 5 times what it was when we took over management. We recently acquired the largest OBGYN clinic in North Mississippi, absorbing their doctors, employees, and their building. We did this so that we could control and improve that service in our region of the state. And finally, we continue to recruit additional doctors and other specialties and build our relationships with local, regional, national, and international partners and supporters. And now, it is time for our team to address the great challenge before us all, which is to create a sustainable model of high-quality health care for the Delta region and in rural America that will be accessible to all of our residents. To accomplish this goal, it will take much more than just money. It will require the cooperation of local, state, and national government leaders. It will require the use of every technology that can drive communication and information. And in many ways, as in so many other industries, high-tech, AI, will provide many of the means to reach, communicate with, and treat our patients. But it will also require something much more. Interestingly enough, in 2018, I met a great Indian philanthropist and teacher, Sadhguru Madhusudan Sai. While in India that year, I learned about the Sadhguru's mission to build hospitals in India and around the world that provided free pediatric heart treatment to children whose families had little or no access to adequate health care. The notion of providing health care to the most needy amongst us had great appeal to me, but seemed impossible to implement in the United States, given the American healthcare system, which depended on a labyrinthian insurance reimbursement system for financial sustainability. However, in 2019, in an act of total selflessness, Sadhguru Madhusudan opened a clinic in my hometown of Clarksdale that offered free medical service to our underserved population, with a special consideration on those who had no medical insurance of any kind. Now, I must admit that the idea of a free clinic seemed to me impossible to sustain. And I wasn't alone. Most of the medical community in Clarksdale scoffed at the idea at the clinic and felt somewhat threatened by the idea that this free clinic might steal some of their patients and some of the money out of their pockets. And yet, today, 5 years later, the clinic has 3 medical doctors and 1 PhD psychologist. It has been relocated to our hospital's medical office building. It is thriving and has become a model of collaboration, not only with our hospital, but with other institutions in our region. And while I like many others in my community, doubted the financial viability of that clinic, I had no problem understanding the idea behind the Sadhguru's efforts. His mantra is to love all and to serve all. While I had grown up in an environment in which healthcare had become more and more driven by corporate concerns of profit, the Sadhguru's seemingly impossible but very successful efforts were driven by a view diametrically opposed to the American healthcare industry. Rather than profits, his idea was that we should all endeavor to take care of our fellow humans out of respect, honor, and love. We were also inspired by the efforts of another man who has become a dear friend, Isaac Tigert. Thank you. The founder of the Hard Rock Cafe chain of restaurants and the House of Blues franchise, Isaac donated a significant portion of his fortune to fund the creation of a large hospital in Puttaparthi. These two men underscore the idea that while financial independence is a necessity, there is also a compelling moral imperative to healthcare which may be realized through foresight, wisdom, and generosity of men like the Sadhguru and Mr. Tigert. Their efforts, which have inspired our efforts to create a more accessible ecosystem of healthcare in our region, give life to the words of the 19th century American theologian Theodore Parker, and paraphrased in 1963 by the Reverend Dr. Martin Luther King. And I quote, "The arc of the moral universe is long, but it bends towards justice." To which I would add, but it doesn't bend on its own. With great intentionality, we have to keep bending it ourselves. These two men and their efforts continue to bend that arc toward decency, civility, humanity, justice, and love, and provide inspiration to a small cadre of people in rural America to follow their lead. So finally, in conclusion, we return to the question, why India and why now? When one thinks of the United States, one often considers a land of immense wealth, exceptional opportunity, and global military might. And it is all those things and more. But within that extraordinary country exist rural areas that were and remain the primary agricultural centers in the U.S., but are often characterized and affected by debilitating generational cycles of poverty for many of its families, exacerbated by the poor health of its citizens. To provide a higher quality of life and to reduce health and wealth disparities, and to rethink the delivery of health care to our population, we look not only inward to our local, regional, and national resources, but also outward to our friends and our partners in other nations, such as India. And when we consider the tremendous responsibility we feel for the outcome of so many lives and for the well-being of so many families, we look for inspiration to the teachings of Sadhguru Madhusudan Sai and Mr. Tigert, whose selfless acts of love and generosity illustrate so clearly that it takes both acts of loving kindness as well as financial resources to lift up a broken people and to help realize the dream all our families all over the world share for a peaceful and healthy future for all our children and the generations to come. I thank you so much for allowing me to be here. Thank you. Thank you so much. Thank you.
Thank you very much, Mr. Jon Levingston, for your wonderful insights. Please give a huge round of applause to Mr. Jon Levingston. Now,